Guys, when it comes to dealing with younger people in the CSA exam, what are the challenges that you often find? Most people come to me saying, can you make a video on how to deal with a young patient? And there's a lot of things that can go with that particular query. Things like how to deal with competence. How do I get that into a 10-minute case? How do I deal with a young person who doesn't perhaps want to give me any information? Maybe it's a sensitive topic or they're a little bit embarrassed. And this video is all about giving you a little bit more confidence to deal with these younger people, not only in real life or in your cases when you're practicing, but for the main exam itself. I'm Arora, I'm a GP and an educator based in the West Midlands, and hopefully you'll find this video of use to you. Let's get started. Now, one of the most common things that I hear at our courses when it comes to young people cases is what happens if the young person doesn't want to give you any information? What happens if they just come in the room, sit there and just become silent? You know, whatever question you ask, nothing really gets any information out. You're looking at your clock, time is ticking away, you're getting a little bit stressed. How do I get things moving along? Well, the first thing to remember is, look, this is going to happen to every single person doing that case. It's not just you. It's not that you've done something wrong. It's not because of you that they're being a little bit quiet. This is their role. This is what they're expected to do in every single case. And they're probably looking to see how do you deal with that uncertainty and that little bit of awkward silence. So a couple of things are very useful. Similar to in our embarrassment video, give them a bit of time, give them a bit of active listening, a few head nods, a few make them feel comfortable. Don't make it appear as if you're rushing them. Because if you do that, they're going to just bottle up a little bit more and it's going to take you even longer and you get even more stressed. Try not to be judgmental. Often they're going to come with things that actually are a little bit more sensitive in nature to talk about, and we can easily give that impression that we're judging things a little bit. Now, it's really important to give them that relaxed atmosphere. Use a few lines like, we deal with this all the time, and look, I'm really glad you've come today. Let's see how far we can get with this. Let's see how we can help you out. Really make them feel that you're not there to judge them. You're there to help them, partner with them, and make a plan that works for them going forward. Think about friends, think about family, in both ways. If a young person has come in with a family member, a mum or a dad, and they're obviously quite quiet, think about asking them a little bit later into the case. Do you perhaps talking, just one-to-one? Would you perhaps prefer if mum or dad steps out for a few minutes? That can often get things moving. Think about the other way. If they come in alone and they're a little bit quiet, think about offering someone to come in with them. How about, you seem a little bit uncomfortable here. Would you perhaps prefer if someone comes with you? Maybe a friend or your mum or your dad or someone that might be close to them that might just trigger off the conversation and get things moving. The confidentiality line. This is one of the most overused lines, I think, in this exam. The moment someone bottles up or becomes a bit quiet, our temptation is to say, everything you say today is confidential. And we hope and we expect, but more hope, that actually that's going to get people to start talking. And often it doesn't. The confidential line is a very good line to use, but I say, don't just jump in and say it after a couple of minutes when you get a young person who comes in a little bit quiet. Save it for a few minutes down the line if you really think that might be appropriate in this case. And just like we said in the embarrassment video, if you use the confidentiality line, make sure you give yourself a small window to walk out of later on in case they divert something that actually you can't keep confidential. So a young person who's quiet can be a really stressful thing to have in front of you when you come to the CSA exam. But don't panic, they're doing this, remember, to every single person on that day, on that circuit. Think of those few key tips and hopefully they'll start to talk and your stress levels can reduce a little bit. Now, when it comes to a young patient case in the CSA, don't forget the psychosocial part and how huge an impact that can have on a case within the CSA exam. Now, you only have to watch our normal psychosocial video to see how much we push the importance of psychosocial in the CSA, but in a young person case, often it's quite neglected. Now, when it comes to an older adult, we all think about the standard psychosocial things, the work life, the home life, and that kind of thing. When it comes to a young person, the angle that you take is slightly different. University, college, these kind of things are so important in a young person's life, and often we neglect to ask about these things. How are they getting on? How are they finding their exam pressure a little bit too much? Are there issues with bullying? Is there issues with peer pressure going on? Do they feel comfortable in their university or college environment, for example? Don't forget relationships, girlfriends, boyfriends. There could be real things going on there that can be impacting reasons that they're coming to see the doctor. Don't forget to explore those things. Relationships otherwise, things like family? Are you getting on with siblings? Is there issues with your parents? Could there be things like pressure to do certain things from higher people in the family? There's lots of things that you need to be thinking about and delving into. Perhaps they're not going to be volunteered to you, certainly not in an early stage of the case. And these things might come out later on if you haven't quizzed them about them yourself. So remember to get the psychosocial things out. Of course, things like smoking, alcohol, again with peer pressure, illicit drug use. There's lots of things that you can think about that can be happening in a young person's life that can be really, really important to the actual case itself. Now, often with psychosocial, we do these things because we feel we have to, but actually in a young person, it might be the fundamental thing that's got them into surgery at that point. So don't forget the psychosocial, have a real effort to dig into that person, into their life, and to what it means to them, and you may get some really key clues to take the case forward. Another common area that people often worry about when it comes to young patient cases in the CSA is, what if I get a 13, 14, 15-year-old? How do I assess certain things like Gillick competence, Fraser competence, and how am I going to be happy myself that what I'm prescribing or what plan we're making is going to be okay to do in that particular situation? I think the first thing to remember when it comes to Gillick and Fraser competence is, hopefully, it should be quite obvious if someone is Gillick competent, Fraser competent to make certain decisions in certain cases. And you want to get a feel for this. You want to do it several times in your study groups. You want to practice not in nice, easy, friendly, happy teenagers. It's about doing the practice in cases where you're practicing as a nervous teenager or an anxious teenager. It's often those cases where it's a little bit more difficult to make that decision or not. So, and it's really important to understand what actually as a doctor am I supposed to be looking for when I'm making this kind of assessment, I suppose. And therefore you need to understand what Gillick competence represents, you need to understand what Fraser competence represents, and essentially it's, are they able to understand information that you're giving them? Are they able to weigh things up, make a decision, come to a judgment? With Fraser competence, it's those add-on sort of questions, isn't it? So, have you thought about discussing things with your parents? And do you not think it might be a good idea to discuss things with your parents? It could help sometimes, finding out what will happen if you don't prescribe contraception today, what their plans are going forward, for example. So all these things are really important to practice. Yes, learn them, number one, but practice them in your study groups, number two, and really understand the importance as a GP of doing these things on a day-to-day basis. So don't be afraid of competence. Hopefully it'll be pretty obvious in a case whether someone has competence or not, but you really need to understand the concepts yourself first, and that's where practicing it in challenging situations in your study groups is really important. Now hopefully that was of some value to you guys. Just a quick recap: if you get a young person who's perhaps not talking or expanding as quickly as you'd like to, think of those few key tips to get things moving along a little bit quicker. Don't forget to bring in their outside environment, their school, their university life. That can be integral in terms of a case such as in the CSA. And don't forget to review those competence points and make sure you get those crystal clear in your mind before you walk into that exam. Now, if there are other videos that you want me to make to do with the CSA or the AKT or GP training in general, just give me a shout, an email or a tweet. My details are down below. Hopefully you found this video useful. If you did, there's some other videos on our channel. Please have a look through, subscribe if you find it useful. We try and make these regular videos as I suggested earlier. So hopefully we'll catch some of you guys soon. Hopefully see some of you guys at our courses. If you're taking the exam in the next couple of months, good luck. I'm sure it'll be great. Take care and see you soon.